CEO of the Netcare Group. Thank you very much, Richard, for joining us. Now, your results are suggestive of a far more positive operating environment, even in the midst of the second and the third waves of coronavirus infections. Just take us through how you were able to improve the numbers.
Well, Nompu, thank you very, very much. It is a resilient performance against the backdrop of what has been a devastating year for us. As you quite rightly pointed out, we've had to deal with a second wave over the December Christmas period, and then we dealt with the Delta variant in June, July and August. So overall, a very difficult year, but we're learning more and more about this virus and how to combat it and how to streamline our operations and be more agile. I wouldn't say we know everything about it. It's a very humbling experience dealing with coronavirus, but thus far we've been able to mitigate a lot of the potential damage in this past year.
Yeah. Now, everybody's talking about inflation these days, and we know that medical inflation is always that much higher. What's been the experience in this regard, and what's your expectation going forward, especially in the face of a weakening rand?
Well, I think inflationary threats are always very significant. And I think that the challenge we have is to make healthcare as affordable as possible and as accessible as possible. And I think nowhere is the stark divide between the haves and have-nots been more evident than in healthcare. And it's not a simple given that people can access quality healthcare. So you would have noticed that we have a division called Netcare Plus, which is looking to develop products for a market that can't access healthcare in the private sector at the moment, and certainly give them access to our ecosystem at lower price points. So directly counter this view that inflation is outstripping the affordability of healthcare.
Yeah. Now, one of the conversations that's become quite topical during, the COVID-19 situation is the state of people's mental health. And we know that Netcare did go forayed into the area of mental health care. You bought a number of investments in that regard. Presumably, that bet has paid off. And you can just tell us a little bit about how that business has performed.
So I think you're referring, Nompu, to a KESO, it's our mental health division. We are growing in that division. Unfortunately, I think there was a huge demand for mental health care before COVID-19, and I think that's been exacerbated by the post-traumatic stress that a lot of people are still facing. And it's a question of how we get to focus on post-traumatic growth. So on the mental health care side, unfortunately, I think we're dealing with another type of pandemic across the world. And one could argue that we've still got a lot to do to be able to provide adequate resources and facilities for people suffering with any mental health condition.
Yeah. We know that COVID has been exhausting, not least for the country's medical staff. How have you ensured that staff do manage to get a break while you ensure at the same time that you have enough capacity to run the hospitals that you run?
Well, I think that's an excellent question, Nompu. You'll notice last year, whilst we were absolutely devastated by COVID, we took a very firm decision that we were going to give people job security and not retrench anyone. And that was important. These are our members of our family, members of the Netcare team who've sacrificed so much on the front line, and we certainly weren't going to abandon them because our financial results were very poor. And I referred to last year, and I think that has paid dividends for us. I think what our challenge is to support people into recovery. It's been a ghastly year, so we are rolling out a compassion program that every single staff member, whether you're a porter or a security guard or a nurse or a manager, will go through to help build resilience and work out how do we take post-traumatic stress in the workplace and convert that to post-traumatic growth. And if I may, one of the silver linings of COVID is that nurses and paramedics and healthcare workers are finally being recognized as a pillar of society. Last year, before COVID, people would say to a nurse, shame. You couldn't get a proper job, you couldn't study, don't climb on this taxi, you might infect us. Whereas now people say, you're a healthcare worker. Wow, thank you so much. And so nurses are being affirmed, and never have they needed to question their calling and their purpose. And I think that's very, very helpful.
Indeed, very important indeed. Thank you very much, Dr. Richard Friedland. He's the CEO at the Netcare Group. The South African commercial